Sexually transmitted infections, or STIs, are a group of infectious diseases primarily spread through sexual contact. These infections can be caused by bacteria, viruses, protozoa, or fungi, and they affect millions of people worldwide each year. Understanding the different types, their symptoms, and available treatments is crucial for prevention and effective management. In this video, we'll explore the most common classic venereal diseases, their causes, clinical presentations, and recommended therapies. Let's begin by categorizing STIs based on their causative organisms, setting the stage for a deeper dive into each major infection. Bacterial sexually transmitted infections are among the most common and treatable STIs. The classic bacterial STIs include gonorrhea, syphilis, chancroid, bacterial vaginosis, and chlamydia. Each of these infections is caused by a specific type of bacteria, and they can present with a range of symptoms or sometimes remain asymptomatic. Early detection and appropriate antibiotic treatment are key to preventing complications and transmission. In the next scenes, we'll look at each bacterial STI in detail, starting with gonorrhea. Gonorrhea is a curable sexually transmitted infection caused by the bacterium Neisseria gonorrhoeae. Humans are the only natural host for this organism, which makes person-to-person transmission the primary route of infection. One of the challenges in controlling gonorrhea is that many infected individuals do not show symptoms, allowing the disease to spread unknowingly. Gonorrhea can affect both men and women, and if left untreated, it can lead to serious health complications. Let's explore how this infection develops and what happens inside the body after exposure. After exposure, Neisseria gonorrhoeae attaches to the mucosal lining of the genital tract using specialized structures called pili and outer membrane proteins. Within 24 to 48 hours, the bacteria penetrate the epithelial cells and reach the submucosal tissue. This triggers a strong immune response, especially from neutrophils, leading to the sloughing off of the epithelium, formation of microabscesses, and the production of pus. These processes are responsible for many of the classic symptoms seen in gonorrhea infections. Men, the incubation period for gonorrhea ranges from 1 to 14 days, with symptoms typically appearing between 2 and 8 days after exposure. The most common site of infection is the urethra. While some men may not experience any symptoms, acute urethritis is the predominant manifestation. This includes profuse, purulent urethral discharge and pain during urination, known as dysuria. Like other types of urethritis, the discharge in gonorrhea is usually more noticeable and thicker. Women, gonorrhea most commonly infects the endocervical canal and urethra. Symptoms may include cervicitis, increased vaginal discharge, dysuria, intermenstrual bleeding, and abdominal pain. However, many women remain asymptomatic, which can delay diagnosis and increase the risk of complications. Pain during urination and abnormal vaginal bleeding are important warning signs. Early recognition and treatment are essential to prevent long-term reproductive health issues. Though complications from gonorrhea are rare, they can be serious if they occur. In men, possible complications include epididymitis, prostatitis, inguinal lymphadenopathy, and urethral stricture. For women, the most significant risk is pelvic inflammatory disease, which can lead to ectopic pregnancy and infertility. These complications highlight the importance of early diagnosis and treatment. The next scene will discuss the recommended therapies for gonorrhea. Primary goal in treating gonorrhea is the complete eradication of Neisseria gonorrhoeae and the prevention of complications. The most effective and widely recommended therapy is a ceftriaxone-based regimen, which is proven to work for urethral, cervical, rectal, and pharyngeal infections. It's important to treat all sexual partners to prevent reinfection and further spread. Let's look at some special considerations in gonorrhea management. Significant number of patients with gonorrhea are also infected with chlamydia. In fact, up to 50% of women and 20% of men with gonorrhea have a coexisting chlamydial infection. Because of this, it is recommended that all patients treated for gonorrhea also receive treatment for chlamydia, typically with azithromycin or doxycycline. This approach helps prevent post-gonococcal complications and ensures comprehensive care. Certain groups require special consideration in gonorrhea treatment. Pregnant women should always be treated with ceftriaxone as it is safe and effective. For individuals allergic to cephalosporins, azithromycin is the only alternative. Children and those with disseminated infections, such as meningitis or endocarditis, should also receive ceftriaxone. For gonococcal eye infections, a single dose of ceftriaxone is usually sufficient, but therapy may be extended if cultures remain positive. Syphilis is another classic bacterial STI caused by the bacterium Treponema pallidum. It is usually acquired through sexual contact with infected mucous membranes or skin lesions. The risk of acquiring syphilis after a single sexual encounter is surprisingly high, ranging from 50% to 60%. Syphilis is also known to increase the risk of acquiring HIV. Let's explore the different stages of syphilis and their clinical features. Primary syphilis typically presents as a painless ulcer, known as a chancre, at the site where the bacterium entered the body. This lesion is highly infectious, but often heals on its own within 1 to 8 weeks, even without treatment. However, the infection does not go away and can progress to more serious stages if left untreated. Early recognition of primary syphilis is crucial for prompt treatment and prevention of further transmission. Secondary syphilis occurs when Treponema pallidum spreads throughout the body via the bloodstream and lymphatic system. This stage is marked by a variety of skin and mucous membrane eruptions, which can be either localized or widespread. The most characteristic sign is a rash, but other symptoms include fever, headache, malaise, anorexia, and swollen lymph nodes. If left untreated, these symptoms usually resolve within 4 to 10 weeks, but relapses can occur for up to 4 years. Latent syphilis is defined by a positive blood test for syphilis without any symptoms. This stage is further divided into early latency, which lasts less than 1 year and carries a risk of relapse, and late latency, which lasts more than a year. In late latency, patients are considered non-infectious and are immune to reinfection, but they still harbor the bacteria. Monitoring and appropriate treatment are necessary to prevent progression to more severe forms. If left untreated, syphilis can progress to tertiary syphilis, which involves inflammatory reactions in virtually any organ, including the heart, blood vessels, and nervous system. Neurosyphilis refers to infection of the central nervous system, which can cause a wide range of neurological symptoms. These late-stage complications are serious and potentially life-threatening, underscoring the importance of early detection and treatment. Syphilis can be transmitted from mother to child during pregnancy, a condition known as congenital syphilis. Treponema pallidum can cross the placenta at any stage of pregnancy, potentially leading to fetal death, premature birth, or serious congenital infections. Early screening and treatment of pregnant women are essential to prevent these outcomes and protect newborn health. Penicillin G remains the drug of choice for treating all stages of syphilis. For primary, secondary, or early latent syphilis, a single intramuscular dose of benzathine penicillin G is recommended. Late latent syphilis requires 3 weekly doses. Neurosyphilis and congenital syphilis are treated with intravenous penicillin G for patients allergic to penicillin. Alternatives like doxycycline or tetracycline can be used, though treatment duration may be longer. Chlamydia trachomatis is the leading cause of non-gonococcal urethritis, accounting for up to half of such cases. This organism is unique in that it shares characteristics of both bacteria and viruses, being an obligate intracellular parasite. Chlamydia is often found alongside gonorrhea, making dual infections common. The risk of transmission is significant, and untreated infections can lead to serious complications. Incubation period for chlamydia varies, typically 35 days in males and 7 to 35 days in females, with symptoms appearing in 7 to 21 days. The most common sites of infection are the urethra in men and the endocervical canal in women. Urethral discharge is usually less profuse and more watery compared to gonorrhea. Many infections are asymptomatic, especially in women, which increases the risk of complications. Men, more than half of urethral and rectal chlamydia infections are asymptomatic. When symptoms do occur, mild dysuria and urethral discharge are most common. The discharge can range from scant to profuse and may be mucoid or purulent. Because symptoms are often mild or absent, many men may not realize they are infected, which can lead to ongoing transmission. Women, chlamydia infection is even more likely to be asymptomatic, with over 2/3 of cervical infections showing no symptoms. When present, symptoms may include abnormal vaginal discharge, uterine bleeding, and purulent urethral or rectal discharge. Dysuria and urinary frequency are less common. As with men, the lack of symptoms can delay diagnosis and increase the risk of complications like pelvic inflammatory disease. Complications from chlamydia are rare, they can be significant. In men, the main complication is epididymitis, which can cause pain and swelling in the testicles. In women, the risk is pelvic inflammatory disease, which can lead to ectopic pregnancy and infertility. These risks highlight the importance of regular screening and prompt treatment, especially for sexually active individuals. Recommended treatments for uncomplicated chlamydial infections are azithromycin as a single oral dose or doxycycline taken twice daily for 7 days. Azithromycin is particularly effective due to its long half-life, allowing for single-dose therapy. Treating all sexual partners and abstaining from sexual activity until treatment is complete are important steps to prevent reinfection and further spread. Genital herpes is a chronic, lifelong viral infection caused by herpes simplex virus types 1 and 2. HSV1 is most commonly associated with oral infections, while HSV2 is the main cause of genital herpes. Once the virus establishes latency in the body, it cannot be eradicated by the immune system or current therapies. HSV2 is responsible for most recurrent genital herpes cases, and nearly all infections are sexually acquired. Herpes simplex virus is only found in humans and is transmitted through direct contact with infectious secretions or active lesions. The virus enters the body through mucosal surfaces, such as the cervix or urethra, or through abraded skin. Because the virus can be shed even when no visible lesions are present, it is possible to transmit herpes unknowingly. Safe sexual practices and open communication are important for prevention. Classic sign of genital herpes is a cluster of painful blisters or vesicles on a red base. Other symptoms include itching, burning, tingling, lumps in the groin, pain during urination, pain during intercourse, and increased urinary frequency. These symptoms can be distressing and may recur over time, as the virus remains dormant in nerve cells and can reactivate periodically. While there is no cure for genital herpes, treatment aims to relieve symptoms, shorten the duration of outbreaks, prevent complications, and reduce transmission. The mainstay of therapy involves antiviral medications such as acyclovir, valacyclovir, and famciclovir. These drugs can help manage both initial and recurrent episodes, making living with herpes more manageable. First episode genital herpes, oral antiviral medications are highly effective in reducing viral shedding, shortening the duration of symptoms, and speeding up healing. The greatest benefits are seen when therapy is started as soon as possible after symptom onset. Early intervention can also help reduce the severity of the initial outbreak and the risk of complications. Immunocompromised patients or those with severe symptoms, intravenous acyclovir may be necessary. However, IV therapy can be associated with side effects such as kidney, gastrointestinal, bone marrow, and central nervous system toxicity, especially in patients with pre-existing kidney problems. Careful monitoring and dose adjustments are important in these cases. There are two main approaches to managing recurrent genital herpes: episodic therapy and chronic suppressive therapy. Episodic therapy is started at the first sign of recurrence, ideally within 6 to 12 hours of prodromal symptoms. Suppressive therapy involves daily antiviral medication to reduce the frequency and severity of outbreaks, benefiting those with frequent recurrences. Trichomoniasis is a sexually transmitted infection caused by the protozoan Trichomonas vaginalis. While humans can host other Trichomonas species, only T. vaginalis is considered pathogenic. The organism can survive outside the body for a short time, making transmission possible through contaminated objects or communal bathing, though sexual contact remains the primary route. Trichomonas vaginalis typically infects the vagina, urethra, and surrounding glands in women. After attaching to the mucosal lining, the organism triggers an inflammatory response, resulting in a discharge filled with white blood cells. This inflammation is responsible for many of the symptoms associated with trichomoniasis, including irritation and abnormal discharge. Women classic signs of trichomoniasis include a strawberry cervix and colpitis macularis, while men may develop prostatitis or epididymitis. Common symptoms are vaginal or vulvar redness, excessive yellow-green discharge, itching, unpleasant vaginal odor, urethral irritation, pain during urination, and a vaginal pH above 4.5. Recognizing these symptoms can help prompt early diagnosis and treatment. Standard treatment for trichomoniasis is a single oral dose of metronidazole or tinidazole. An alternative regimen is metronidazole taken twice daily for 7 days. Cure rates are highest when both sexual partners are treated at the same time. For pregnant women, the single-dose regimen is preferred. If initial therapy fails, a second course or higher doses may be needed. Vaginal candidiasis is a fungal infection caused by Candida albicans. While not always sexually transmitted, it can occur after sexual contact and is included among classic venereal diseases. Symptoms include itching, burning, and a thick, white vaginal discharge. Treatment typically involves antifungal medications, either as topical creams or oral tablets. Chancroid is a less common bacterial STI caused by Haemophilus ducreyi. It presents as painful genital ulcers and swollen lymph nodes in the groin. Prompt diagnosis and antibiotic treatment are important to prevent complications and further spread. Chancroid is more prevalent in certain regions and populations, but awareness is key for early intervention. Bacterial vaginosis is caused by an imbalance of normal vaginal bacteria, often involving Gardnerella vaginalis and Mycoplasma hominis. It is characterized by a thin, grayish discharge with a fishy odor. While not strictly an STI, it is associated with sexual activity and can increase susceptibility to other infections. Treatment involves antibiotics such as metronidazole or clindamycin. Human immunodeficiency virus, HIV, is a viral STI that can lead to acquired immunodeficiency syndrome (AIDS). HIV attacks the immune system, making the body vulnerable to infections and certain cancers. While there is no cure, antiretroviral therapy can control the virus and allow people with HIV to live long, healthy lives. Prevention, early testing, and ongoing care are essential. Trichomonas vaginalis is the main protozoan responsible for STIs. Humans can also host Trichomonas tenax and Trichomonas hominis. However, only T. vaginalis is considered pathogenic in the genital tract. Understanding the differences between these organisms helps in accurate diagnosis and treatment. Preventing sexually transmitted infections involves a combination of safe sexual practices, regular screening, vaccination where available, and open communication with partners. Using condoms, limiting the number of sexual partners, and seeking prompt medical attention for symptoms are all effective strategies. Education and awareness are key to reducing the spread of STIs. Notifying sexual partners about potential exposure to an STI is an important step in controlling the spread of infections. Partners should be encouraged to get tested and treated, even if they have no symptoms. This approach helps break the chain of transmission and protects the health of everyone involved. Regular screening for sexually transmitted infections is recommended for all sexually active individuals, especially those with new or multiple partners. Early detection allows for prompt treatment, reduces the risk of complications, and helps prevent further spread. Many STIs can be asymptomatic, making routine testing an essential part of sexual health. Sexually transmitted infections during pregnancy can have serious consequences for both mother and baby. Some infections can be transmitted to the baby during pregnancy or delivery, leading to complications such as premature birth, low birth weight, or congenital infections. Pregnant women should be screened for STIs and receive appropriate treatment to protect their health and that of their child. Being diagnosed with a sexually transmitted infection can be challenging, but with proper treatment and support, most people can lead healthy lives. Open communication with healthcare providers and partners, adherence to treatment, and regular follow-up are important for managing the condition and preventing transmission. Remember, STIs are common and treatable, and seeking help is a sign of strength. Summary: sexually transmitted infections encompass a wide range of diseases caused by bacteria, viruses, protozoa, and fungi. Early detection, prompt treatment, and preventive measures are essential for controlling the spread and minimizing complications. Regular screening, safe sexual practices, and open communication are the cornerstones of sexual health. Stay informed, take care of your health, and encourage others to do the same.